Hello, today we're going to be discussing placement of tympanostomy tubes for recurrent ear infections. The patient is brought to the facility, which is usually an outpatient facility, and is taken back to the operating room with an anesthesiologist and accompanied often by a nurse. At that point, the surgeon meets the patient and the other healthcare providers in the room. The anesthesiologist places a mask over the patient's face in which they breathe inhalational gas, and they are off to sleep within just a few seconds. At this point, the patient's placed on their back in preparation for the procedure. This procedure is performed using a microscope because the eardrum and all the other structures are very small. The microscope is brought into view and focused on the patient's ear. A speculum is inserted into the ear canal in order to open it for visualization of the eardrum. There's oftentimes debris in the canal, such as wax, that needs to be removed before we can perform the procedure. Once we have the eardrum in good view, we choose our location to place the incision. Once the incision is made, the contents that are behind the eardrum need to be evacuated. We use a suction to do this. Once the contents are evacuated, we then are ready to place a tube. Usually we use something called a temporary tube. Temporary tubes just imply that the tube will stay in place approximately 9 months to 15 months. These tubes are designed specifically to be placed in the eardrum such that they cannot fall behind the eardrum. They only fall out of the eardrum when they are no longer needed. The tube is then placed, and as you can see, there is a hole in the middle of the tube. All tubes have some kind of hole in the middle of them, and this is in order to aerate the space behind the eardrum to avoid reaccumulation of pus, mucus, or fluid. Then drops are placed and a cotton ball is placed, and that ear is complete. This whole process really takes approximately 5 to 10 minutes, depending on how much wax or other debris may need to be removed from the ear canal prior to placing the tubes.